My name is Dr. Abha Rai, and I'm an assistant professor at the School of Social Work, Loyola University, Chicago. Today, we're very excited to have with us Dr. Aimee Hilado, who's going to be talking to us a little bit about her work at Refugee One and about the resettlement of refugees from Afghanistan. Before we get into the specifics of today's reporting, I will take this opportunity to introduce Dr. Hilado. Dr. Hilado is a 0 to 3 fellow, licensed clinical social worker, and academic researcher specializing in immigration trauma and immigrant refugee mental health. Dr. Hilado is the founding clinical director of the Refugee One Wellness Program, a mental health program established in 2011 for humanitarian immigrants in the Chicagoland area. Previously, Dr. Hilado was an associate professor at the School of Social Work for 8 years at Northeastern Illinois University. In January 2022, she will be joining the faculty at the University of Chicago Crown Family School of Social Work Policy and Practice. Dr. Hilado completed her PhD in social work with distinction and Master of Social Work degrees at Loyola University Chicago and Master of Science in Applied Child Development at Erickson Institute. Thank you so much for joining us today, Dr. Hilado. To get us started, you're welcome. To get us started, can you help us understand the various immigration categories, statuses that apply to Afghan individuals and families seeking refuge in the US? Can you please explain the implications of each of these categories for resettlement and support as we understand it today?
Happy to do so. When we're thinking about the Afghan communities that are coming to the United States, there are 4 specific statuses that are being applied to this group. The first is special immigrant visas. This applies to anyone that supported our US military, US contractors, that they had done that time as interpreters in the field. And with that immigration status, when they arrive at the United States, they're treated very similar to refugees, in which they get specific benefits that are administered by the Office of Refugee Resettlement through the State Department, as well as resources that are allocated through the State Department's Bureau for Population, Refugee, and Migration, PRM. So you'll hear me say the term PRM, ORR throughout. For SIVs, special immigrant visas for short, for SIVs, they have a direct pathway to citizenship. Within 10 months of arrival, they're able to adjust their status with a green card and then apply for citizenship within 4.5 years upon arrival, from the date of arrival. They also have access to federal dollars that support with resettlement and placement. They are able to access state benefits, including SNAP, cash assistance, Medicaid. They are able to be resettled through refugee resettlement programs and access the English language training programs, employment and housing services. And so a whole host of services that really do support their integration into life in a new country. Another status you will hear applied to the Afghan community is refugee status, specifically Afghan P2 refugees. These are individuals that have served in the same capacity as SIVs, in that they supported US military services, they were US contractors, but they didn't complete the time period that would give them that SIV status prior to evacuation. But they too, P2 refugee status, they are able to access the same benefits as SIVs. So pathway to citizenship, federal and state benefits, a real social safety net. A third group you're going to hear about are special immigrant parolees. And on their immigration documents, not to go too deep in the weeds, you'll see an SI or an SQ code. Again, these are folks that did similar work to SIVs, but they were not able to get their paperwork processed in Afghanistan before they were evacuated. So again, those 3 different groups, SIVs, P2 Afghan refugees, and the special immigrant parolees, SISQ, all of these 3 groups, they have worked with US military, they have worked as US contractors in Afghanistan, they are given privileges upon arrival here in the United States. The group that a lot of people are talking about are the humanitarian parolees. These were those that were emergency airlifted out of Kabul, who are being processed at US military bases abroad, in Qatar, in Germany, or being brought directly to US military bases here in the United States. It was this group that we were a little bit concerned across, resettlement programs, in the sense that this group does not have a pathway to citizenship. Humanitarian parolee gives status in the United States. It's a stay on deportation. They are able to access employment authorization and a social security number so that they are authorized to work in the United States. But anything beyond that, the resettlement dollars that help with reception and placement, the Medicaid coverage, access to SNAP, cash assistance, assistance for families with young children, that's not, at the time when this originally happened, that was not available for humanitarian parolees. Now, that said, as of October 1st, today, Congress did approve a spending budget through the end of the year that had new provisions. In that new provision, these Afghan parolees, the humanitarian parolees, will now have access to the same public benefits as SIVs, P2, refugees, and special immigrant parolees. They will be able to, again, access Medicaid, SNAP benefits, cash assistance. They will also get federal dollars to help with reception and placement. What the Afghan parolees, these humanitarian parolees, will not have, which is different from the other three categories I mentioned, they will not have a pathway to citizenship. They will still be required to apply for asylum upon arrival. But this new congressional bill also authorizes that they should be given expedited courtesy when they file their asylum applications. That means that their applications should be reviewed within 45 days of receipt, and that a decision needs to be made within 150 days of application. That sounds promising. I think that thinking about immigration status, that's a worry for many immigrants in the United States. It's certainly on the mind of Afghan parolees. Our concern is that that expedited review has also been issued to other communities. And so we are still advocating with Congress for a more clear pathway to citizenship that doesn't necessarily involve the asylum process. Also approved as of yesterday, September 30th, 2021, Congress has authorized additional funding for Afghan arrivals. And so the infusion of an additional $1.68 billion to help with integrating, resettling these communities across cities across the United States. It also gives authorization for parolees, humanitarian parolees, to have access to driver's license, real IDs, which will also be helpful in terms of them adjusting to life in a new country. So in brief, again, 4 statuses, the rights and privileges vary depending on the status, but it is an ever-changing landscape, and this can change in the next couple of weeks as we continue to put pressure on Congress to have a more sustainable plan for our Afghan arrivals.
Thank you so much for providing that very detailed overview of the different statuses. Now moving on to, hearing a little bit more about, specifically the role of Refugee One. Can you share with us how you are preparing to resettle Afghan refugees in Chicago or in other parts of the US as applicable?
Happy to do so. Refugee One is one of a national network of resettlement programs that do this work on behalf of the State Department. And as we prepare for the Afghan arrivals, there are things that we have to operationalize on the ground. That the arrivals will need housing. So we are working with landlords to be able to identify affordable housing, working with Airbnb landlords, trying to find options to ensure that once the arrivals are here in our city, that they are able to move in directly to a fully furnished apartment and be able to start rebuilding their lives here in a new city, in a new country. It's also about lining up employers, recognizing that part of integrating and adjusting to life in a new country is to get back into the workforce and start earning money to help pay for the rent, since federal dollars and state dollars that pay for housing for these arrivals will be limited to about 3 months. Resettlement has always been a public and private partnership, and so we're leaning on federal and state dollars as well as private foundations and the goodness of donations from those in the community that really want to respond and help people ensure that that basic need of housing and a job, that they're met. There are also cultural considerations. This is a new population. We are not new to resettling Afghan refugees, but Afghan Afghan arrivals who are coming from the acute trauma that they've experienced in being emergency evacuations from their home country, that's different. So really working with community leaders to get that cultural orientation. What should we know about these Afghan arrivals? What are the ethnic distinctions, the different languages, the cultural traditions, the things that we should pay attention to as we start to welcome these newly arrived groups? For programs like Refugee One that have a nested mental health program, like my program, we are preparing our workforce for what we can anticipate in terms of the mental health needs and the health considerations we need to make as we welcome these new arrivals. Many refugees from the other countries that we've resettled over the last decades, Refugee One has been doing this good work since the 1980s, that oftentimes many refugees have been waiting in camps or in urban cities for on average 15 to 17 years as they wait for a resolution. In that time, physical health and mental health presentation tends to look different. From the reports that we're hearing on US military bases, from our teams that were deployed and supporting directly Afghan arrivals, what we're hearing in the media, the circumstances surrounding the mental health needs of Afghan arrivals will look different from resettlement populations we've welcomed in the past. That there will be a range of reactions to adjusting to life in a new country. Those that are in continued fear of the uncertainty of their futures, those that are excited to be here, but we also recognize that, again, the circumstances of evacuating folks from Kabul in those last weeks, they were quite traumatic. I think that the video clips, the news reports from the ground show that these are folks that were taken from a very dangerous situation. And many of them, some of them were separated from family members, some of them were sent to different bases. So as we are preparing to welcome, we're keeping all of these potential considerations in mind. How do we attend to basic needs? How do we think about the communities and organize ourselves to welcome arrivals? But also, what are the concrete needs that will be presented to us once they arrive? That includes mental health needs, that includes getting kids enrolled in school, getting them to health providers, making sure they have access to English language training, and all the things that are core services to refugee resettlement programs.
Thank you so much. Along the same lines, if you can provide us an overview of some of these numbers, how many families are we looking at? What is the placement? How many Airbnbs are we thinking? What is the timeline? If you can share, some data around that, that will really help us understand the extent of these numbers that we're looking at.
So in terms of the estimate numbers that we are receiving from the Department of State, they roughly estimate about 75,000 Afghan parolees to come through. And this is not counting SIVs, P2 refugees, special immigrant parolees. And so we're talking about very large numbers that are going to be integrated to different resettlement cities across the country. In terms of flows that are coming to Illinois, 500 have been earmarked parolees, humanitarian parolees. So I'm not going to give you the SIV numbers, those that are coming with a pathway to citizenship. I'm going to speak specifically to humanitarian parolees. We are looking at 500 coming to Chicago and an estimated 700 that will be coming to Illinois. The number will be higher when you start to add SIVs, P2 refugees, and the other statuses. The timeline for when they will actually be arriving in the state, arriving in the cities, could be anywhere from the next weeks to the next months. And those that will be released first are those that are currently residing in or near US military bases here in the United States. There's 4 different military bases at this point that are working with Afghan parolees. Part of the delay is just getting initial paperwork done, making sure background checks are completed. In some cases, there have been measles outbreaks in the bases that are located in Texas. So making sure everyone has access to the measles vaccine. Know that arrivals also have access to the COVID-19 vaccine. So all of this really does influence the flow of when folks will be coming into our cities. And we're hoping that, again, the arrivals that will be coming to Chicago, coming to Illinois, will be predominantly from the US bases here in the United States. We can anticipate that the arrivals will continue steadily through the next months, through the next years. We still have folks that are at risk in Afghanistan. So there are global diplomatic conversations that are happening now to think through how can we safely help those in Afghanistan who are seeking to leave the country and then safely be processed for refugee status in a second country. Those will likely be the flows of individuals that will continue to come in the months and years ahead. But know that the work ahead is now. They are here on US soil, and we are preparing to welcome them in the coming weeks and months.
Thank you. I know we talked a little bit about this earlier, but if you can briefly share some of the main challenges around resettling this, group of people coming in from, these war zones, these very difficult situations. What are some of the main challenges that, perhaps Refugee One or organizations in the US in general are probably experiencing or are going to experience as the resettlement happens?
I will say that when it comes to supporting humanitarian immigrants, we really have to think about the trajectory of their migration journey. We think about the experiences that happened in home country, the experiences in transit to the United States, and even their experiences once they're here in our cities. And all of that has a cumulative impact on how people function, their mental health, their physical health, and really how well they're able to adjust to life in a new space. And if we were to zoom out and think about just the common denominators of immigration trauma, that there is this history of fear, worry about the unknown, worry about their future, constant need for safety. Despite being in the United States and being away from conflict, make no mistake that many people that we serve, they miss their homeland. They miss the people they left behind, the country, the culture. And because we're so connected with global technology, that oftentimes they know what's happening in their countries in real time. The survivor guilt is real. How am I here and safe? And so many people that I love have been left behind. All of that has a cumulative impact on mental health and how people are able to adjust to life in a new country. And so that certainly is something that we're thinking about with the Afghan arrivals. Again, the stories we're hearing on the ground, the stories of those that are already doing this work, it's this recognition of they weren't waiting for a resolution. They weren't waiting years for a resolution on what will happen next. These are emergency circumstances, people that are not sure where they're going to land. And the uncertainty of their immigration status in the United States further exacerbates the fear and worry for the future. And we want to be prepared for that. And programs are gearing up to welcome folks that may be emotionally overwhelmed and being thoughtful in our engagement to ensure that we can navigate folks who've experienced acute trauma, who feel they're in a state of crisis, so that we can help them really orient to life in a new country, help them calm, remind them that they have the skills to navigate difficult decisions and they won't be alone in the process. They've got organizations and communities that are ready to welcome them.
Thank you. Could you share a little bit about some of the main community mobilization efforts that have been conducted or are ongoing as Refugee One prepares for our incoming group of refugees from Afghanistan?
I think the beauty of that, when there are crises, that there are so many people, good people, that are willing to step up and support the cause to ensure that people feel safe in a time of great uncertainty. And at Refugee One, we're the largest refugee resettlement program in Chicago, and we have seen an outpouring of support, mobilization of efforts to ensure that we can welcome Afghan arrivals as well as all the refugees that we anticipate coming to the United States, coming to Chicago, in a way that, again, really preserves the humanity of the work that we do and really becomes that welcoming first step into rebuilding their lives with safety and dignity. What are those efforts? We have got a ton of volunteers. So we probably have amassed more than 800 volunteer requests to be part of the process of welcoming arrivals to Chicago, welcoming them to the United States. And that is more volunteers than we've seen in 8 years. We have seen just an increase in the number of groups that want to co-sponsor families. So we have a model at Refugee One in which we will pair arrivals, individuals, families, with a group of individuals that want to also further support the adjustment process to life in a new country. This could be faith-based organizations, a group of friends, alumni groups, but they're tasked with visiting the families regularly to help also in a financial way, supporting rent over the course of 6 months, but really being that ally, that friend that really helps walk through what life can be like in Chicago. And our co-sponsorships, at this point, our development team has said, we have enough sponsors to match every family that arrives based on estimated flows from the State Department for the next 5 years. So it's beautiful to know that not only will arrivals have the support of Refugee One, but they'll have the support of community members and volunteers that will be alongside with them. And we're partnering with Afghan community leaders, again, as a different group that is coming in from very unique, difficult circumstances to really have that cultural guide in how we can do this in a culturally and linguistically sensitive way. All of these are things that we're doing to prepare ourselves to really welcome groups that have gone through so much and really help them rebuild their lives here.
Thank you. That is truly powerful and definitely, beautiful. And we'll sort of circle back to that towards the end of this recording, where we can talk a little bit more about ways in which we can, facilitate call to action for all of our listeners today also. Before we get into that, are there, any salient policy implications that you'd like to sort of highlight in relation to the Biden administration? I know we talked some about this, towards the beginning, but is there anything else that you'd like to add to that?
Right now, there is advocacy for the Afghan Adjustment Act, and we will continue to advocate for that. And we encourage you to contact your legislative leaders to really ask Congress to take action. And really what we're hoping through the Afghan Adjustment Act is a direct pathway to citizenship. We understand the backlogs of the asylum process that already exist. And so really building kind of an infrastructure to put these safety nets in place. And immigration status in the United States is really important. And we want to make sure that there is congressional leadership and really clear policies on how we will process and how we will give a pathway for these Afghan arrivals. We also are wanting to encourage Congress to really think through building back the refugee program. Under the Trump administration, it was very much dismantled. We know that a presidential determination will be announced by the Biden administration very soon. We are in a new federal fiscal year, and the refugee ceiling, the general refugee ceiling, beyond kind of addressing the Afghan crisis, is to raise arrival numbers to 125,000 per year. We're actually advocating for a higher number. Hopefully we can get to 150,000 in the next fiscal year. And keep in mind, the number that we resettled, the ceiling for refugee arrivals, was just 17,000 arrivals at the last year of the Trump administration. So we are talking about dramatic increases to the refugee program. But we were also recognizing that we need advocacy and financial support to build back the US refugee program, to build back the network of providers that were abroad who could do the circuit interviews to get refugees abroad ready for travel, get them through the pipeline so that they could be resettled in the United States, and also building back the network of refugee resettlement programs. The network had contracted under the last administration. There were many agencies that closed. We're hoping that as we continue to welcome refugees and other humanitarian immigrants, that we can build those programs back, build our infrastructure so that we can continue to welcome higher numbers who really are in need of a solution rather than just waiting abroad.
Thank you. Are there any other, future initiatives at Refugee One or otherwise relating to the broader scope of refugee resettlement work that you'd like to share with us today?
In terms of future initiatives, we found that in response to the last administration and really just a trickle of refugee arrivals, a lot of resettlement programs started to expand services to other statuses, to include asylum seekers, to include services to those without documentation, unaccompanied children. And it seems as if that is potentially a trend that we will continue to follow. I think with financial support, resettlement programs can certainly be a hub for all humanitarian immigrants that are seeking to rebuild their lives in new cities because of the core services that resettlement agencies have. I touched on this before, but resettlement programs, we are staffed by virtue of State Department requirements with programs including English language training, intensive case management, employment services to link up new arrivals with employers, housing supports to help people navigate the housing market here in the United States, medical case management programs to really help folks understand the medical systems here in the United States and navigate the difference between a primary care provider versus a specialist. Programs have youth programs to help kids enroll in K through 12 programming. These are all initiatives that are so important for any new arrival, and the hope is that future initiatives will establish these core services and provide adequate funding so we can serve across status. We have a mental health program at Refugee one that I've been running for the last 10 years, and I understand that this is not a core service necessarily in resettlement programs. I've seen firsthand the benefits of supporting mental health and health for newly arrived immigrants who are coming from forcibly displaced situations in which they have no choice but to leave. There's a well-founded fear of persecution. Trauma is often woven into their narrative. And if we really want people to adjust to life in a new country, to really thrive in English classes, to really thrive in the job, to thrive in their relationships in their families and with their peers and in their communities, we cannot ignore health and mental well-being. And so my hope is there's future investments across the resettlement network, across the country, that really do establish mental health and health services as core services within programs that serve humanitarian immigrants. That's a hope.
Thank you so much. And now, trying to circle back to our call to action piece, for those like me who are interested in finding out more information about how, we can volunteer our time and, try and stay involved with Refugee One, can you provide us with some information?
Happy to do so. I think at the federal level, at the state level, we need to continue to advocate for clear guidance, clear leadership, clear policies that really support Afghan arrivals. Again, the Afghan Adjustment Act would be an answer to that. Really keeping the Biden administration and Congress, holding them accountable to increasing the refugee ceiling, but also building the infrastructure for us to do this work well. For those that really want to get involved at the ground level, know that there are resettlement programs that are welcoming Afghan arrivals even now, who will welcome volunteers, welcome co-sponsors that can pair up and be a welcoming hub to our new arrivals. We also are looking for donations. And again, I'm going to ask you to use caution. There are a lot of folks that are running fundraising drives. We need to make sure that folks are donating to trusted organizations where the funds will go directly to the Afghan arrivals. We also encourage you to work with landlords that you may know or Airbnb hosts that may be willing to house refugees in their buildings, really thinking about how to create that basic safety net of making sure folks have shelter. If you are working with employers, people that own small businesses, encourage them to consider connecting with resettlement programs and opening up positions and hiring refugees and parolees that are arriving and ready to really get their life started and getting that first job. These are all wonderful ways to get involved, to volunteer, to find housing, to donate your time, donate your resources, get employees on board, and really working with our leadership at the state level and at the congressional level to really think about how do we do this well in a coordinated and collaborative way.
Thank you so much, Dr. Hilado. This was truly a pleasure to learn more about your work, your passion, and the role of Refugee One in this very important work we're trying to now, accomplish together as a country. Is there anything else that you'd like to highlight or, leave us with to think about for the future that we may not have already talked about?
I will say that in terms of the pandemic and arrival flows, we know that it's not happening. Arrivals are not coming as fast as we would like, but the same energy that we're seeing in the community now, the energy to respond and to help people that are really coming from difficult circumstances. I want to encourage people to keep up with that energy, to stay informed, to stay connected, and know that we are going to be continuing to do this good work in the years to come. And there are going to be opportunities to welcome other arriving groups, not just those coming from Afghanistan. And we hope that you will continue to be willing partners in this important work of really supporting folks that are rebuilding their lives here in our city and here in our country.
Thank you. Thank you so much. And we're excited to keep hearing from you about all of the wonderful things that Refugee One would continue to stay engaged in. Thank you for coming.
Thank you for the time.